today. Allie, who did you bring with you today?
This is my mom. Hi, I'm Bryn. It's nice to meet you.
Nice to meet you, Bryn. So this is our first session after that initial appointment with the other PT. So they kind of gave me some background, so I'm just going to run that over to make sure that's kind of what we're dealing with. And then the doctor and the PT said that you kind of have a couple questions about your daughter's diagnosis specifically. It is a little bit complex to understand, so I will try my best to hopefully explain it in a way that helps you understand a little bit more, okay?
Okay.
So I'm just looking at it, and it looks like right now you're not weight bearing at all with some crutches, correct?
Yeah.
Okay. And that when you're kind of doing your self-cares and stuff, you're mainly obviously putting all of your weight on that left foot. And water in the shower is pretty painful on that leg.
Yeah, I can't even get in the shower. I just tried the other day. I had my mom try and help me, just put my feet over the tub
Sure.
and sit in a chair outside the shower, and I couldn't do the right leg at all.
So normally are you just showering with your foot outside, or?
Yeah, that, or I'm giving myself kind of like a makeshift sponge bath.
Sponge bath, and then just washing your hair in the sink. Okay, sounds good. And then we have a little bit of limited range of motion right now in that right lower extremity and all joints there.
Yeah, it's just kind of stiff and not moving that much.
Not moving that much. Okay. Well, I'll go over our goals for therapy too. Increasing the range of motion is going to be one of them. And it seems like you have a little bit of edema on that right knee.
Yeah, they said that word. I think I don't know.
Don't know what that means. So that means you just have some swelling and inflammation over that area. So
yeah,
it's probably a little bit puffy to you.
Yeah, she does have
big. A lot of that. So we'll teach you a technique to try to get that out of there, and that we can also use the same technique to do something called desensitization, which I'll also explain what that means. Okay, that's specific to your diagnosis of that CRPS. And then it looks like you have a little bit of pain that increases with movement and different things that kind of make that ankle burn a little bit. So
yeah.
Okay. So what our plan today is I'm going to go over the diagnosis a little bit better to help you understand, and then we're going to learn a few exercises for at home to do in between after this session today before our next session next week. Okay? She does the desensitization because you can use that as a desensitization thing to her ankle. I'm just gonna mention that.
Yeah.
Because you can do both, right? Or unless you just want me to do edema for the first session.
Okay.
Okay. I think you're mainly there just because it says that, well, first off, she's 17 and can't drive, or because of her, and then you're there because you also were slightly confused with the diagnosis. Okay. All right, guys. So over the course of the next couple of weeks, we're going to be addressing a few different things. So we're going to be working on the education of the non-weight bearing and the weight bearing stuff, and then also education on the diagnosis that your daughter has gotten. We're going to work on strengthening. We're going to work on increasing that range of motion in those joints because they're a little stiff right now. Working on balance and agility training, and then also help normalize that gait, because after you are out of off of the crutches and stuff, it's going to feel a little bit weird to walk, so help you walk normal again. And then have that tolerance to different types of touching and stuff for that leg, since it seems to be pretty sensitive to different things. Main goals obviously at the end are to decrease pain, increase range of motion, and then get you back to gymnastics, since that is your sport that you are currently really good at practicing, and you want to get back to that. So
I know I'm missing nationals. It's actually happening tomorrow. We were supposed to leave, and now I can't go.
Well, we can cheer the team on, but it is really important, obviously, you're not able to weight bear, but it's really important that we do the right things to help with that, so it doesn't linger a little bit longer than we already want it to. So taking the right steps now to fully heal and better your body will be better and best for you to get back to the gymnastics soon. Okay? Sounds good. And it seems like you have a good support system that can help you as well.
Yeah. I have my mom and all of my friends.
Yeah, it seems like you have another sibling and a dad at home as well.
Yeah. Although my sibling is not very fun.
Well,
hopefully don't say that about your sibling.
Well, we're gonna show you a few things, and one of them is mom can try to help you with too. I think it's gonna be better if mom helps you, kind of helps and decrease pain and sensation in that leg. Okay.
Okay.
All right. So, mom, you had a question kind of about what does CRPS actually mean.
Yes.
The doctor probably used a couple terms that were a little bit hard to understand.
Yeah, kind of. I guess I would just kind of, an explanation of it.
Sure.
That I would be able to understand.
Yeah.
Because, I don't have a medical background. I'd love to understand it, if that's okay with you.
Yeah, of course. I want to try to explain it the best I can since it's, again, complex, that's in the name. But I'll explain it how I would explain it to someone, and if you still have questions after, just let me know, okay?
Okay.
So CRPS, it's complex regional pain syndrome. Basically, this is a type of chronic pain that happens after a trauma, a surgery, different types of stuff like that. It's usually after a trauma or a surgery. There's other things, but obviously for her, she had a trauma to that knee or ankle. So now her body is kind of experiencing pain in a way that's worse than the original pain, basically, from what she originally experienced after she already is like healed, is what CRPS pain comes from. So it also can produce discoloration, which it did say that she did have a little bit of blue coloring in that leg, especially maybe in the morning or after certain activities. And it can also have inflammation and stuff like that, which we are seeing in that right extremity as well. So basically, your body, the CRPS is caused by that inflammatory response from both the central nervous system and the peripheral nervous system. And your daughter's body is overreacting to that type of stimuli. And she's not able to shut off her nervous system. It keeps telling her that there's something there, that something's painful, that something's wrong, even though that her body is healed from that injury. If that make a little bit better of a sense?
Yeah, it does. So it's basically just pain coming from her own trauma.
Yep. And I like to re-educate the patient while we're doing exercises and you that the body is healed now, and your pain is coming from your mind thinking that there's pain. There's not actual more trauma. Your body's not getting hurt anymore by doing these exercises. One big treatment goal is desensitization for CRPS. So we're kind of poking at the body's nervous system to nudge it to kind of get a better response to that pain. So we're kind of pushing it so that we know our body is in safe space and it's not actual pain and it's not causing any harm to that body.
Okay. So pushing her won't do like any further damage. She may think it's like more pain though, because it's all just in her mind.
Yep. So now that she is recovered from that sprain and she's working on getting back to it, things like range of motion and strengthening might cause a little bit of pain because the muscles are weak, and that is normal. But the things that are causing her body to flare up itself, like the water, is not doing any harm to her body. That's just her nervous system not knowing how to regulate what she's feeling. Okay. So we're gonna try to work towards letting her body know that those things are okay.
Okay. That makes more sense.
That makes sense to you as well?
That does. Yeah, because I was trying to take like ibuprofen and stuff, and the pain wasn't going away.
Yeah. So this is more like a nervous, system type of pain. So again, you might still get pain since you have a little bit of edema too. It might still be from that injury, but the majority of your pain is coming from this CRPS. So we're gonna try to retrain your body as well with strengthening and increasing that range of motion. Okay. So this is week 1, so you might be feeling a little bit sore after as well, but we'll get your body working, and after a couple weeks, get you back to action. Okay. Okay.
All right. Cool.
Perfect. All right, we're gonna go over the 3 exercises that I want you to do at home over the next course of that week. Mom can help you; she can listen in so she knows what you're doing, and we'll go from there. Okay. Okay, so the first home exercise that we're going to do is called ankle ABCs. So this is going to help improve that range of motion for one of our goals that we're working on. So for the first week, I'm not going to be adding any resistance. Basically what you're going to be doing with that right leg is you're going to be long sitting kind of like this, or if you're in your bed and you can just like move to the edge, basically so that your foot is off of the side so there's nothing below you. So we're going to pretend that her foot is able to be off the table that you can see. So with that, what we're gonna do is just draw the ABCs with your foot. So you're gonna have your toe up and you're gonna just do an A and then go to a B, and you're just gonna write the entire alphabet with that ankle to help increase the range of motion in that ankle. Does that make sense? It's a pretty straightforward exercise.
How many times do I write the ABCs?
I'm gonna have you go through it 2 times. Does that sound okay? We don't wanna do too much to your body right now since we're still in that first week, okay?
Looks good, honey.
So, again, no resistance for this or anything, just off the bed. Make sure you're doing this twice a day, and letting your body do a little rest in between each set too. Don't go right back into it. Give yourself like a minute or so to rest in between.
Looks really good.
Any questions with this exercise at all?
I don't
Pretty
think so.
straightforward.
Yeah,
Okay,
pretty
perfect.
straightforward.
Hopefully we can progress into using a band to give some resistance in the next couple of weeks as well.
Okay. Z. okay.
Good. It
Just
needs
felt like a little bit of work.
a little bit of work. Your body is not used to, your ankle specifically isn't used to all of that. So this would be a good one to do. Pretty simple. You can do it. It took 30 seconds to do. So shouldn't be a problem to get that done throughout the day. Okay.
Should she do this every day?
Yeah, I would have her do it every single day.
Okay.
If she can't do it every day, most days is probably gonna be good because we need to retrain that ankle.
Yeah. Okay.
So
Alright.
So this next thing we're gonna do is called an effleurage. It's basically just like a light massage. So there's a couple different uses for this. It can be used for her edema in her knee, but also desensitization of the lower extremity itself. So basically that swelling in your knee, we can use light touch to try to disperse the swelling and reduce the inflammation that's around her knee. And then also if we like kind of put it lower at the ankle where she's experiencing a lot of those painful symptoms from different types of stimuli, this can help be a first step in desensitizing that area by pushing into that pain that she's feeling for that.
Okay.
So we would do this on her actual skin, but for the video we'll just have her pants on. Basically all you're going to be doing is light stroking over the area of inflammation.
Okay.
So you're
just doing this
light
on her knee?
stroking. Yep. For this one, if we're working on the reduction of the inflammation and swelling around her knee, you can just be laying. If it is comfortable for her, she can also even elevate that leg a little bit while you're doing it. But I don't want you to have a lot of pressure for this one. We're just lightly stroking, always keeping our hands moving on this knee. Okay.
Okay.
Do you want to try, or does that make sense?
Yeah, I can try.
Okay. You can do it from over there if you like. So yeah, just very light. And then
Do I gotta keep one hand on her?
Yep, you got to keep one hand on her at all time, just kind of working that swelling, okay?
Okay.
You can do this for about 10 or 15 minutes a day. It doesn't hurt to even do it multiple times a day.
Okay.
But helping get that swelling out of there right away.
Okay.
Make sense?
Cool.
We can use the same technique on her lower leg, ankle as well for the desensitization. So I've seen like lots of different stimuli like water touching, which we're going to work up towards, but first we need to kind of work on getting that sensation with just like the feeling of something on there.
Okay.
So all you're gonna do is that exact same thing right over kind of her ankle.
Okay.
This is gonna be painful for you. So while it is over your ankle, since those things are kind of stimulating pain and making you feel like there's pain, this is not gonna be the most comfortable experience, but having someone else do it might help too. You can kind of focus on yourself, just working through that pain, breathing and staying calm while mom or dad or whoever works on rubbing over that ankle that is a little bit sore, okay? Does that make sense? Why we would do those types
That
of
does
things?
make sense.
Okay. And then lastly, we're gonna do one other exercises for your weight bearing, just to help, progress your weight bearing to the next step. We are going to be doing toe taps while you're brushing your teeth. So I read that you're using your left foot to support yourself while you're doing this, and this way you can do two different things with one. So you don't have to take extra time out of your day to do this. You'll just do it while you're brushing your teeth. It should be perfect 2-minute time frame to kind of do these things with. Do you have like a little step stool in your bathroom that you could keep by your sink?
Yeah.
Yeah? Okay, perfect.
I do.
So, what?
It has fishies on it.
Has fish on it?
It does.
Perfect. Okay, so can you transition yourself to sitting on the edge of the bed, please? I know your group probably doesn't know.
For the purpose of this video, we will say that my booted foot is the bad foot, so I'll be standing on the right foot, even though in the case, the right foot is the injured foot.
Yes. And we would pretend that she's obviously at a sink because she's gonna be doing this at her house. Do you need like a crutch or something, Todd? I'm good. Okay. So what you're gonna do is, this is just toe tap weight bearing. So while you're brushing your teeth, you're obviously balancing on that left foot. You can use your other hand, hold on to the counter for support. All you're gonna be doing while brushing your teeth is tapping the top of that step. Yep. And then you're just gonna bring it back down. While you're brushing your teeth, we're gonna do this 2 or 15 times. You can't double task, I guess you'll just have to do it before you brush your teeth, but pretend, sink. Does that make sense? Any questions with that? We're just introducing, the feeling of some type of weight bear underneath that foot.
Yeah.
We'll progress that as we move on in the weeks of therapy. So again, 2 times 15 when you brush your teeth. You can do it in the morning when you brush your teeth and then at night while you brush your teeth before you go to bed, okay? Yeah. Any questions at all?
No, I like that she has something to do, or she's doing it while she's doing something.
Yeah.
I think that's really good.
That way she can just get it out of the way and it's not taking extra time throughout her day. I'll give you a printout with pictures and how often and how many reps and sets I want you to do. That way you don't forget. And then we'll see how they're doing next week when you come back in for therapy, okay?
All right. Thank you so much.
Yeah.